Well, actually, the Cape is no different than anywhere else in the country. We're certainly experiencing a large amount of overdoses, and unfortunately, many of them have been fatal over the past several years here on the Cape Cod. So we're about the same here on the Cape with the opiate problem as the rest of the country is. We have, and actually we've started about several years ago. We first started by giving some of our staff to the Barnstable Police Department to become part of their very successful street crimes unit, and we've also had people assigned to the Cape Cod Drug Task Force for many, many years. Along with that, here at the correctional facility, we developed a program using a drug called Vivitrol. Vivitrol is what's called a blocker. What it does is it actually blocks the receptors on the brain that give you the euphoria from opiates and alcohol. It lasts for a month. It is an injection, and we've been very successful with that program. We've treated up to 150 inmates so far, and the results over the past 3 years when we've been using this drug have been very successful. On the law enforcement side, what I like about Vivitrol is it doesn't have any street value. It's not going to be something that's diverted through prescription use, and it doesn't have any withdrawal. You don't withdraw from it, so it's something that actually helps people maintain their sobriety, either from alcohol or opiates. As long as they do everything else, it still requires counseling and all the necessary things that go along with recovery, but it certainly is a very important tool in the toolbox that we're now using here at the correctional facility. The road that got us here was kind of, I think, the medical profession decided along the way, and I think probably justifiably, that with the new pharmaceuticals we have nowadays, that nobody should be in pain. If you notice when you go, if you've been into a hospital emergency room, they have the little smiley faces on a chart on the wall asking you how much pain are you in. In the hospital, the docs were trained to reduce pain, and they had the medications to do that. So I think that was one thing that hurt us, and as a result of that, all these pain clinics were opened for the most part in Florida, and folks from this part of the country were actually driving to Florida and going to as many pain clinics as they could go to and getting some of these strong pharmaceuticals, the OxyContins, the Percocets, the Vicodin, getting as many of those as they could in Florida, and then returning here and selling them on the street back here for $1 a gram, $1 a milligram, which was a pretty lucrative trade for these people. I think after complaints from many states to the governor of Florida and the federal government, there was a crackdown in Florida on these pain clinics, and that source dried up. And that's one of the things that, folks who were addicted now to pharmaceuticals couldn't get their pharmaceuticals, so they hit the streets and ended up being addicted to heroin, and that's why we're having the overdoses that we're having today, relative to heroin use. This stuff is so powerful, the opiates that are out there nowadays, and the heroin is, it's not your father's heroin. It's not that everyone's father was an addict, but it really addicts people. It's really a high-grade narcotic that's being used out in the street right now, and it's very difficult to beat it. So the best way to avoid it is never get started. And every time I meet with we have young high school kids coming through the correctional facility weekly, and I'm here, I have the opportunity to go out and talk to them, and I really stress to them not to get involved with the opiate issue or alcohol. I mean, 80% of the folks that come here to the correctional facility have some issue with drugs or alcohol, and so we certainly encourage our young folks to stay away from that. And I think a lot of the programs out there, their program and the war on drugs are getting a lot of heat, saying that they're failures, but the way I look at it, if we didn't have those programs, where would we be? We are where we are relative to drug abuse, but if we didn't have those prevention programs over the many years in the past, where would we be? I mean, so I think we just have to keep doing everything we can and put all our efforts to educating our young folks about the dangers of these drugs, kind of similar to what we did with tobacco. The tobacco war on tobacco was very successful. Of course, we had a lot of funding for that from the tobacco industry as a result of the attorney generals across the country suing the tobacco industry. So, I think if we can get a funding source so that we can do the same things with opiates, I think we'll be on our way to finally resolving the problem or at least reducing the problem.